Too many buttons. There. Welcome, everyone. We are presenting our plans webinar today. We have quite a few people joining us, so I'm asking you all to mute your mics and turn off your cameras. If something happens and the meeting goes down, we will use the same link to get back in, but nothing's going to happen today. The sun is shining, the sky is blue, it's not raining. Yay. You're welcome. Please put your questions in the chat as we go through the webinar, and we will try to answer them. We'll try to answer as many of them as we can. And then let's see, today joining me is Beth Pierce from the Maine Primary Care Association, Dan Dudley from Anthem, Christy Pendexter from Community Health Options, Jody Cutting from Harvard Pilgrim Healthcare, and Connor Allen from Tarot Health. Kate Endy, CAIC's policy director, is helping with the presentation. Valerie McCausland from CAIC is helping with the technology and working her magic in the background. Rachel Collmore is helping out with the chat. She's our consumer assistance program manager. And I'm Helen Roy. I am the education and outreach coordinator here at CAIC. So again, welcome. I'm glad you all are joining us. Let's see, I got one more note here. Please remember that the information we are presenting is on an as-is basis, and we are not guaranteeing its completeness, accuracy, usefulness, or timeliness. Please remember that provider network and drug formulary information is subject to change, and this information, plan benefits, and coverage should be verified with carriers prior to enrolling. And CAIC is assuming no responsibility for any errors or omissions in the content of this webinar. So here at CAIC, our mission is to advocate the right to quality, affordable health care for every person in Maine. And CAIC, we are Maine's health insurance consumer assistance program. We help consumers and professionals. We screen consumers for eligibility for Maine Care and marketplace coverage and help them apply. We offer guidance and sometimes take on private insurance appeals when a consumer's medical care has been denied. We help professionals through workshops and training such as this one. Many assistants call us with eligibility questions and questions about Maine Care denials. Our policy and advocacy work takes us to the legislature and from time to various state agencies. We have Coffee Cake, which is our weekly e-newsletter, and we also have the sister listserv. So let us know if you want to join the listserv or if you want to receive Coffee Cake. So here is our agenda for today. Beth is going to talk briefly about the Maine Primary Care Association. We'll go over Cover Me, what's new for this year with plans, things that you need to know, keep in mind, and then key factors to consider. And then after all that, the carriers who are with us today will share their coverage plans for 2023. And if we have time, we may be able to do a brief question and answer. So I am going to turn it over to Beth from the Maine Primary Care Association.
Thank you, Helen. So a little bit about who we are at the Maine Primary Care Association. We're actually a membership organization that represents the collective voices of Maine's community health centers, or what we also refer to as federally qualified health centers, or FQHCs. Our health centers provide high quality primary care, preventative medical, behavioral health, dental services to about 1 in 6 Mainers. And we have been around for 35 years, and we provide technical assistance and training. We house relevant programs and services, and we advocate on behalf of Maine's healthcare safety net and the hundreds of thousands of patients it serves each year. And within this work, we strive to strengthen Maine's health centers with the programs and services such as clinical quality improvement, workforce development, community outreach, health information technologies, risk management planning, strategic planning, and technical assistance. We also strive to amplify messages shared among the health centers, bridge medical practices, and public health sector, and provide linkages to community, state, and federal partners, including public health and allied agencies. So our mission here at the PCA, as we refer to ourselves, is to champion and maximize the value of Maine statewide community health center network for the health and well-being of all Maine people. Our vision is a Maine where healthcare is high quality, comprehensive, affordable, and accessible to all. Our work and that of our members is rooted in the values of strategy, innovation, quality, collaboration, and authenticity. Next slide, please. And as you can see by this slide, we have multiple locations. Here in Maine, we have 20 FQHCs. And if you look, you'll see that there'll be multiple dots of the same color, and that indicates multiple locations belonging to the same health center. And they're all throughout the state, ranging from the west in Rangeley, north all the way to Madawaska and Fort Kent, to the east in Eastport, Lubec, and then south to Springvale. One of the reasons why the PCA participates in these meetings and presentations is that we house assisters at our health centers, and they do a great job of providing enabling services and access to health care for patients that need it throughout the state. And we partner closely with CAIC because they are an excellent source of education and materials. And lastly, if you are looking to help someone find a health center location in Maine, what you need to enter is just findmyhealthcenter.org, or you can go to the Maine Primary Care website, which I believe was just put into the chat. And I will also add my personal email if you should have any questions, because the other work that I do here at the PCA is oral health. I believe that is my presentation.
Yes. Thank you, Beth. Thank you. People are still joining us, so I'm letting them in. So our next section, we are going to go over Cover Me, Maine state-based health insurance marketplace. So Cover Me, Maine switched over to a state-based exchange in 2020. And this is our second year of using coverme.gov to apply and enroll in coverage. The Office of the Health Insurance Marketplace within the Department of Health and Human Services oversees coverme.gov. We also have the plan comparison tool on coverme.gov's website that allows consumers to enter their family members and income and whether they have the offer of other coverage to see if they are potentially eligible for premium tax credits and cost sharing reductions. Consumers can also enter their doctors, hospitals, and medications to see how they will be covered by the available plans. And the Access Nav mode with the screening tool allows Maine enrollment assisters to help folks who may not be eligible for Maine care due to their immigration status. And also it allows folks who may be in the foster care program that are under 26 but eligible for Maine care. So that's just a neat little tool that's available. And also at Cover Me, folks can be screened for Maine care eligibility. So we can use that application during open enrollment to screen for Maine care eligibility. So open enrollment this year is going to start on November 1st. I believe that's next Tuesday. And folks who enroll between November 1st and December 15th, their coverage will start January 1st. Open enrollment is also running till January 15th. So folks who enroll from December 16th to January 15th, their coverage will start on February 1st. So it's a little longer again this year as well, which is really nice. So here are the plan levels that are available at coverme.gov. Catastrophic plans are available to those who are under 30 or those who have a hardship exemption. And the hardship exemption is still granted by the federal health insurance marketplace and not coverme.gov. And I believe there's an application for that. It's been a while since I've worked one of those. Catastrophic plans are not eligible for premium tax credits, and they tend to have lower premiums and high out-of-pocket costs. And typically the plan's deductible has to be met before the plan will pay. Catastrophic plans cover the first primary care visit that is not preventive care at 100%, and the copays for the second and third for both primary care and behavioral health care count towards the deductible. I also should mention that the first behavioral health visit with a catastrophic plan is also covered at 100%. Bronze plans have low premiums and high out-of-pocket costs, and they cover 60% of covered benefits. Bronze plans with an HSA or with the term HSA in their names work with a health savings account. These bronze plans do not have the non-preventive primary care and behavioral health benefits. For 2023, there are several bronze plans that have copays for primary care visits. So check the plan's details to determine whether the bronze plan includes copays for primary care. Silver plans have slightly higher premiums and slightly lower out-of-pocket costs than bronze plans, and they cover 70% of covered benefits. Silver plans work cost-sharing reductions. It's the only metal level that does work with the cost-sharing reductions. Gold plans have higher premiums than bronze and silver. They have lower out-of-pocket costs, and they're covering 80% of covered benefits. And then platinum plans have the highest premiums and the lowest out-of-pocket costs, and they cover 90% of covered benefits. An important thing to remember, all plans, except those bronze plans that are HSA eligible, cover the first non-preventive primary care visit and the first behavioral health visit at 100%. There's no cost to the enrolled person. The second and third visits for both types of care have a copay, and the copay counts towards the deductible, as do subsequent copays for both types of care. And that's something new, and we'll touch on that further in. And then who is offering plans this year at CoverMe? Anthem Blue Cross and Blue Shield, Community Health Options, Harvard Pilgrim Healthcare, and Tarot Health. And Tarot Health is new. They're offering plans just in Cumberland County, and we will learn much more and hear much more from Connor when we get to that part of the presentation. So what's new for this year? And I'm going to turn it over to Kate, and she's going to talk to us about merged markets and other things that are new. Thanks, Kate.
Oh, sorry about that. Thanks so much, Helen. So beginning in 2023, Maine is merging its individual and small group markets. What this will do is it essentially creates a larger risk pool that will help stabilize premiums, since Maine's individual market and small group market separately were both pretty small. So whenever risk pools are larger, they generally tend to be more stable, and the more stable they are, the more stable premiums are, which is a good thing. It also extends the benefits of the Maine Guaranteed Access Reinsurance Association program, which right now only is benefiting individual plans. Is going to extend those benefits to small group plans to help lower premiums in that market, because over the past several years, they've been seeing extremely high increases that have made it a pretty volatile market on its own. So it's going to especially help small group plans to bring down those premiums. And then clear choice plans are now going to be introduced to small group as well. So for the most part, the same plans that are available in the individual market are going to be available to the small group market. There are some silver HSA plans that are going to be available only either to the small group or off marketplace. So they would be still available to individuals, but not necessarily on the marketplace. And that's just to kind of preserve the subsidy eligibility integrity of that, since that's based off of how expensive the plans are. So next slide. Copays for behavioral health and primary care visits in both individual and small group plans are now going to apply to the deductible, which previously a lot of copays generally didn't apply to the deductible. So this means that even if you have first dollar coverage for primary care or behavioral health, and you just pay a flat copay copay and you don't have to pay your deductible, that $25, $50, whatever you're paying, that's going to help accumulate for you to reach your deductible, which will help people meet their deductibles more quickly. Oh, next slide. We just wanted to point out a new feature in the provider search tool on coverme.gov. So when you're searching for providers in your area, you can change the distance that you're looking within. We had heard from some people who were searching for providers and providers that they thought were a network and they weren't coming up. And it was that provider was outside the radius of the zip code that they had entered. So just a reminder that you can update how large that radius is to make sure that you're getting the full amount or the full provider list. Next slide. So what do you need to know? So of course, all marketplace plans cover the 10 essential health benefits as mandated by the ACA, with the exception of not all plans include pediatric dental. Some do, but in states like Maine, where we do have standalone dental plans available on our marketplace, health plans right now aren't required to embed that benefit. So that's the one exception. Next slide. So clear choice plans, they're available both on and off the marketplace at all metal levels. Basically, clear choice standardizes deductible, out-of-pocket costs, cost-sharing amounts between plans to make it easier for people who are shopping to make apples-to-apples comparisons and really understand the differences between plans and benefits. Each carrier is allowed to offer up to 3 alternative benefit designs. And there's a number of clear choice plans. So for example, there are, I believe, 6 different silver plans or silver plan designs that are going to be available or carriers are allowed to offer on the marketplace next year. And so just because it's a silver plan and it's a clear choice plan doesn't necessarily mean it's the same, using the same design as every other clear choice silver plan. So the name of the plan should say, silver 3,000, and then the company, or, bronze 8,000. And basically that's how they're distinguishing it. So if you look at the name, all of the silver 3,000s, which is the deductible that correlates to, you can kind of compare just if you want to compare a specific clear choice design between carriers, that's how you'd be able to do it. And for, this is outdated, so we'll have to fix this before we set up the slide deck. So in 2022, this year, there were 12 clear choice plans designs available, 10 of which were permitted to be on the marketplace. So next year, there are a few more than that. So we'll update that before we send out the slides. And just a reminder that every year, the Bureau of Insurance, who is creating these designs, they do that with stakeholder input. And so they hold usually multiple stakeholder meetings and accept written comments from people when they review and make changes to the clear choice benefits. And so certainly, assister input is extremely valuable. You're the ones working with people every day, going through these plan designs and hearing feedback from people. And so, certainly would love all input at that time. And if anybody has questions about how to get involved with that, then please do reach out to me and I can connect you with that process. Next slide. So here are the clear choice plans for 2023. All of the yellow boxes are services that are covered before the deductible. And so you'll notice that there are copays in certain plans that are not yellow. So, even though it's a copay, somebody would still have to meet their deductible before they pay that copay. And these are just the Clear Choice plans on coverme.gov. There, as I mentioned earlier, there are a handful of other Clear Choice plan designs that may be available off marketplace, specifically silver, additional silver HSA options. Next slide. So there are some variations allowed within Clear Choice and alternative plan designs. So of course, if somebody qualifies for cost sharing reductions, the benefit structure is going to look a bit different than what's outlined there, since they'll have lower copays, lower deductible, and out-of-pocket max. And it could also vary by whether it's a HMO or PPO, or if it's a tiered network. If it's a tiered network, the Clear Choice benefit amount is supposed to be used at whichever tier offers the broadest network of providers. Plans can also use an additional tier if they have low-cost generic drugs that they want to apply a lower copay to than the generic drug amount, copay amount that's specified in the Clear Choice plan, or if they have a site of service incentive program. And so I just mentioned this because carriers can offer the same Clear Choice plan design in multiple plans. So they would share the same basic cost sharing structure, but one might be an HMO versus a PPO, or one might be a tiered network versus a non-tiered network. And so, sometimes we've gotten questions about why, there are so many, or, why, if it's limited to 3 alternative plans, why are there actually more available in certain situations? And that's why. So it's limited to the 3 benefit structures, but within alternative plan benefit structures and Clear Choice benefit structures, there can be some variation allowed. I will say that this year, the vast majority of marketplace plans appear to be Clear Choice. And we're seeing more of those alternative benefit designs off marketplace. All right, next slide. And so I'm gonna pass it over back to Helen.
Thanks, Kate. Can you all see me and hear me okay?
We can't see you.
Okay.
Can't see you, Helen, but we can hear you okay.
Okay.
Oh, I can see you now.
Thank you. Too many buttons. Kate, we've got a question in the chat about Maine implementing the same adverse tiering rule as the federal marketplace, and I don't know the answer to that one.
We can send that in the follow-up. I'd want to double check just to make sure.
Okay, great. Thank you. Thank you. So let's see here. I'm ahead of slide. Let's back up. So provider networks. So there are 2 kinds of networks. HMOs, they're narrower. Your primary care doctor needs to be in network, and then also a referral is needed when you need to see a specialist, and the specialist needs to be in network in order for the plan to pay. For care that is out of network, care that's needed out of network, prior authorization is needed from the insurance company. PPOs are a little broader in that you can go out of network. Primary care providers should be in network for the lowest costs. You don't need a referral to see a specialist, and the specialist can be out of network, but if the specialist is in network, again, you'll have the lowest cost shares. Both HMOs and PPOs cover out-of-network emergency care, but prior authorization should be obtained for any out-of-network care that's beyond the emergency. And then these 2-tiered plans, these 2-tiered provider networks. Many plans on the exchange here in Maine have 2-tiered provider networks, and you'll see them as you'll see them as preferred provider or non-preferred provider. So again, using the plan comparison tool, preferred providers show up with a green dot and non-preferred tier providers show up with an orange dot. And it means the orange dot means they're still covered. They're just in that non-preferred tier. Both preferred and non-preferred network providers are covered. Cost to use a non-preferred network provider may be higher than the cost for providers in the preferred tier. And then some plans have the same deductible and out-of-pocket maximum for both provider networks, but some have a higher out-of-pocket costs for non-preferred tier providers. So it's always good practice to check the plan's summary of benefits to see the appropriate cost shares for the plan's preferred provider tier and non-provider tier. A consumer I worked with a couple of years ago, they didn't realize that their plan had the two-tiered network, and they saw a specialist that was in that non-preferred tier, and he didn't realize his cost shares were going to be higher to see that provider. Now, the non-preferred tier versus the preferred tier, the plan cards in the plan compare tool show, well, they're showing this particular provider is being in network. And here's what the green and the orange dots I had mentioned just a minute ago. So the orange dot means that this provider is in this non-preferred provider tier for this particular plan. I don't know which plan it is. And then the green dot, this other plan, the provider is showing up as being in the preferred tier. So it will cost more to see this provider with the plan that has her in that non-preferred tier than the plan that does have her in the preferred tier. She's a non-preferred provider in that plan on the left-hand side. So to determine the cost to see her, you look at that two-tier under the specialist visit when you open up the plan to see all the details. And for this particular plan, you'll see she's tier 2, the non-preferred tier, and it's going to cost, you got to meet the deductible first, and then there's a 60% co-insurance after that until the out-of-pocket maximum is met. Now, the plan on the right-hand side of the screen, she's in network. She's showing up with that green dot, so she's in the preferred tier network. She's a tier 1 provider. So again, opening up the plan and looking at the details, we can see she's tier 1. So there's an $80 copay after the deductible. So this plan here too, you got to meet the deductible, and then once it's met, there's an $80 copay. If she were in the non-preferred tier with this plan, again on the right-hand side of the screen, you'd meet the deductible first and then have a $130 copay to see her. It's always good to double check the plan summary of benefits to see how the tier 1 or tier 2 works for tier 1 providers and tier 2 providers. And then two, it's good to remember that when you're looking at the plans in the plan comparison tool, the preferred tier provider network costs are what appear on the plan card. To see the tier 1 and tier 2, open up the details, but then also remember to check the summary of benefits for that plan that you're considering. Because again, we don't want anyone to get any surprise costs or bills because they didn't realize a provider was in that non-preferred tier, like what happened with the person that I was helping a couple of years ago. So drug.
Helen, not to interrupt, but just another kind of a point to make in regard to that. Never be afraid to call the provider's office yourself as well and double check with the provider to see how they're contracted with any particular carrier, whether it's Anthem, Harvard, CHO, any of us that are in the individual market space. The providers actually will know best as far as how their contracting is set up, whether they're a tier 1 or tier 2, or they're completely out of network. So just something to
yes.
realize.
Thanks for that tip, Dan. Yes, I have done that myself when I've helped somebody. we, my method of operation with trying to find providers and making sure they're covered is using the plan comparison tool first. And if the provider's not showing up, then broaden it out, like Kate showed us earlier, broaden it out, because you can broaden it out up to 100 miles. And then if they're still not showing up, then what I'll do is go and Google the provider and see if they're working with a particular practice, right? And I used to be able to put the practice in. That was with the federal platform. And then if the practice still wasn't showing up, the provider wasn't showing up, I would have the person I was helping call their provider and then also call the carrier just to double check everything, make sure that doctor was going to be covered by that.
Yeah, that's a great practice. Very, very good recommendation.
Thanks. Yeah, because I know for me, I don't want anybody going with a plan that's not going to work for them. So let's talk a little bit about the prescription drug coverage and the drug formularies. And this here too can be something that can be a little daunting or a little tricky to figure out. But remember, one of the 10 essential health benefits through the ACA is prescription drug coverage. And all the carriers have their drug formularies with different tiers for medications that they cover. The lower the tier of medication is, chances are that that's the lowest cost, the cost shares for it. The formulary also lists any conditions or limitations associated with a medication. Some drugs have quantity limits, meaning the insured can get so many pills in 30 days, or example, like one inhaler per 30 days if somebody's got asthma. Some drugs require step therapy, meaning the insurance company won't cover the medication without the insured trying a lower cost drug first. And if that doesn't work, then they'll cover the higher cost drug. In those cases, the insurance company may need to see medical records from the doctors and doctor's notes showing that lower cost drug's not working. And then some plans do have drug copays before the deductible. Some plans have the covered member pay the deductible first and then have a copay for the drug. So another important tip is to check the plan's summary of benefits and then also just double check the carrier's formulary to see how the drug is covered. And again, with the plan comparison tool, when you're looking at the plan details, you'll see a link to the summary of benefits. You will see a link to the drug list for that particular plan. The way the drug tiers work, tier 1 is typically generics and they have the lowest cost or the lowest copays. Tier 2 drugs are typically preferred brand drugs and they'll cost a little bit more than tier 2. Tier 3 drugs are typically non-preferred brand drugs, and these cost more than drugs that are in tier 1 or tier 2. And tier 4 drugs are typically specialty drugs. Meds in this tier do have the highest costs. And again, I always, when we're looking for medications and they don't show up, I'll go right directly to the carrier's site, to the carrier's formulary and look that way. And then also look to see if there's any of those conditions or limitations associated with the medication. Yeah, again, because I don't ever want somebody going with coverage or picking a plan that's and then they go to use it and it's not going to work well for them. The chart over here on this slide is just showing you the different tiers and the different copays. And this particular one is saying these copays are after the deductible. So if someone signed up with this plan, whatever the deductible is, they'd have to meet that first, and then these copays would kick in. Last year, I was working with somebody and they didn't have a lot of health needs, but they did have some medications they needed. And the plan we were looking at, he said the premium was really good. He could afford it. But then when we looked at how the meds were covered, we saw that he had to meet the deductible first before there was any copays for the meds. So just double check that with the folks you're working with. Dig into it a little bit because again, it's important that their needs will be met by the plan they go with. Coverage requirements for 2023 plans. Hearing aids are covered. Let's see, covered up to $3,000 per aid per year. And then this benefit is available every 3 years. There is subject to the deductible and cost sharing in marketplace plans. Cost sharing for insulin, for all types of insulin, can't cost more than $35 for a 30-day supply, which is really good because we used to hear a lot of folks facing challenges trying to afford their insulin. Again, behavioral health and primary care. I really like this benefit. The first visit for behavioral health and for primary care that's not preventive is covered without any cost sharing to the insured person. And then the second and third visits for both types of services may be covered or must be covered before the deductible, so they have a copay. And now these copays are counting towards the deductible. They're accumulating towards the deductible. And then for reproductive health, all plans must provide coverage for abortion services here in Maine. And then dental benefits. I know there are some plans on Cover Me that have the pediatric dental benefit embedded in them. So that means that that plan is going to provide pediatric dental benefits. There are standalone dental benefits available, but unfortunately we can't see them using the plan comparison tool. But when you're helping somebody through the application and you've submitted the application and then you're in the spot where you're enrolling, you'll see the option to enroll in health coverage, and then you'll see the option to enroll in dental coverage. I'll tell folks to go visit Anthem and Delta Dental, the websites directly, to see the plans that are available, especially if somebody is just shopping for a dental plan outside of Cover Me. I mentioned the health plans embedding. Some of them embed pediatric dental. Oh yes, adult dental is not covered by the health plans. Again, the adult dental would be a separate dental plan. And then vision benefits. Vision benefits for children are covered by all the plans available at Cover Me. And then some plans do provide adult vision benefits. It may be just the annual exam, but glasses or contact lenses may not be covered. So again, good practice is to check the summary of benefits. And then again, if that doesn't answer the question, a call to the carrier is always a good option as well, to make sure that that plan, or if you've got a question about that particular plan covering adult vision. So some key factors to consider when choosing a plan. So what's the most a plan is going to cost? Sometimes you may work with somebody who, or they're uninsured and they've got questions about coverage and they're wondering, well, you know, I'm healthy. Why do I need to enroll? Why do I need to have the health insurance plan? Well, this is a good way to illustrate it. So you can say to them, well, you know, and this happened to me personally. I fell and broke my wrist. I had surgery. That surgery was roughly $21,000. So without insurance, I would have been on the hook for the surgery, plus the visits to the orthopedic surgeon, plus the visits for the physical therapy that happened afterward. So, you know, that could be a lot of money. So if I, compared the cost of that against the cost of having insurance, I would see probably it would be more beneficial in the end to be covered. So you can do the comparison by taking the monthly premium, multiplying it by 12. That's how much you're going to pay for the premium over the cost of the year, and then add the out-of-pocket maximum to it. And that is the most they will pay for their coverage, plus any healthcare, major healthcare that they may need throughout the year. yeah, I from time to time do get questions, well, why should I have insurance? And I'll use that comparison. And then shopping for multiple family members. CoverMe allows family members to enroll in separate plans based upon individual healthcare needs. There are several things to consider when looking into doing this. How much care will they need? Does one family member have higher healthcare needs than another? Is there a young person in the family that may not need a lot of care and benefit from a catastrophic plan? So these are some things to consider when you're working with a family. And then, family plan versus having multiple plans. So some more things to think about. Let's see, will the separate plans for individual family members be more beneficial than being on one plan? So if everyone's on the same plan, there's one monthly premium. The plan has an individual deductible and out-of-pocket maximum and has a family deductible and out-of-pocket max. Each individual family member has an individual max and the family has a maximum. So all the individual deductibles and co-insurance, they add up to that family maximum. So if there are two family members reach their individual out-of-pocket maximum first, then all the other family members are covered for the rest of the year at 100%. This year, the maximum out-of-pocket for an individual is $9,100, and for families, it's $18,200. When family members enroll in separate plans, there's a monthly premium for each plan, along with each plan having its own out-of-pocket maximums to meet. So something else to keep in mind, there may be a family with providers who are in separate plans. So like Tom, he may see an oncologist that's not in network for a plan that works well for his wife, Judy. So there's a whole bunch of things to consider when working with the family, not only costs, but of course, networks, and which plans will work the best for either the family as a whole or for individual family members. Health savings accounts, they let you set aside money to use for qualified medical expenses on a pre-tax basis. And these HSAs only work with plans that are HSA compatible. Typically, they're high deductible health plans, and they're usually in the bronze tier. But as Kate mentioned, I know there's one in the silver tier this year. And then plans that indicate HSA in their names work with health savings accounts. So the HSA can be used for medical bills that go towards the deductible and co-insurance. HSAs may be used for things not covered by your plan, such as eyeglasses. And then withdrawals for qualified medical expenses are not taxed. And then money that's not spent in the HSA in 1 year can roll over for the next year. So you don't lose any money that's not spent. But things to consider with a high deductible health plan and an HSA. You pay for all of your care until you reach the plan's high deductible. And that benefit of the first non-preventive PCP visit and first behavioral health visit being fully covered, and then that the copay for the second and third visits for both types of care are not applicable to plans with the HSA option. It may be hard for somebody to set money aside into an HSA if they have a lot of other expenses. It may not be a good option for someone with a lot of healthcare needs or a family with children who see the doctor a lot, or someone, again, who has a hard time setting money aside. So again, weigh all the options. Maybe a plan with lower out-of-pocket costs would better fit the needs of someone with a lot of medical cares. A lot of medical needs. So priorities and trade-offs. Again, there are several things to consider when shopping for health coverage and helping people shop for health coverage. Is it better to have lower monthly premiums or lower overall out-of-pocket costs? Does the plan under consideration have any first dollar coverage for services that don't go towards the deductible? Does the plan cover your providers? Are they a network? Does the plan require a referral to see specialists? And then are the specialists in network? Are any out-of-state providers covered? Sometimes someone has established providers out of state, and you want to make sure those providers are covered. And then does the plan provide specific benefits, such as the annual adult vision screening, or how many physical therapy, occupational therapy visits are covered? Does the plan cover chiropractic care? And that is what I've got for our portion of the webinar today. I see a lot of questions, a lot of in the chat. So are there any questions? Any further questions? Okay. Rachel, thank you for monitoring the chat.
Of course, you're welcome. I did the best I could. I can't answer every single question because some of it is outside of my realm of expertise, but to those of you who didn't get an answer, we will do our best to dig those up and get back to you as soon as possible.
Great, thank you, thank you. So up next, we're going to hear from the 4 carriers with plans at coverme.gov for 2023. First up will be Dan Dudley, and he'll tell us about plans from Anthem. After Dan, Christy Pendexter will talk about offerings from Community Health Options. And then after Christy will be Jody Cutting from Harvard Pilgrim Healthcare, and she'll tell us about Harvard Pilgrim's plans for 2023. And lastly, Connor Allen will take us through Tarot Health Plans options for residents of Cumberland County. So again, I want to thank you all for being with us here today. And then again, as we go through everyone's presentations, please put your questions up in the chat and we'll try to answer as many as we can. Thanks, Dan. You're up.
All right. Well, thank you very much, Helen. And to everybody here on the call today, thank you for joining us. I just wanted to see if somebody could come on, just let me know if my audio was through okay. I know when I was listening, I was having a little bit of crackling there. I can turn my video off if needed. I just want to make sure the audio comes through clearly. So can someone give me an okay that they can hear me all right?
I think video off would be helpful.
Okay.
Thanks, Dan.
Yep. Is that any better, folks?
That is better.
That is better.
That is better. Oh, good. Okay. So you won't get to see my lovely Anthem face today, but that's just fine. So again, I'd like to thank you for letting me join you today at this afternoon's meeting. I can't emphasize enough, to Helen's point about folks that are questioning whether or not they should have coverage or not have coverage, what coverage to choose. Just a real quick story before I get into the meat and potatoes of our Anthem slides here and the other carriers present their slides. My nephew, 26 years ago, my nephew was born at Maine Medical Center, 1 pound, 11 ounces. So he was one of the smallest preemies that was ever born at Maine Med. And you know, he's the son of my brother. He is 26 years old today, but at that time, you know, we all weren't sure if Garrett was going to make it or not make it. And he was in several different facilities around New England, just trying to survive, you know, all those years ago. In terms of coverage, luckily my brother did have full coverage for his family back then. And if he hadn't, he would have still been in financial ruin today. I want to say that years ago, my brother ended up adding up all of the different receipts and claims activity and things like that for his son when he was in the NICU and going through all these other specialists and things like that. And it was over $3 million in claims adjudication just to keep my nephew alive and to help him to survive to be the man he is today. So that's just a quick story that touched my own family. So I share it sometimes with audiences that I speak with, that it really is an important decision for you and your families, and as well as the people that you're helping out there in the marketplace to help them find the right coverage that's going to meet their own needs, because you never know when a Garrett situation is going to come up for yourselves. So if we could flip to the next slide, please, that would be great. I've been with Anthem now for 32 years, and I've been involved with the individual market here since the ACA came to fruition. I typically work in our small group market, but I do dabble in individual as well. So for 2023, as most of you know, we did roll up the choice plan designs back in 2022. Kate gave some great information around the merged marketplace, small group plans versus individual plans. Luckily for individual, we're not making a heck of a lot of changes when it comes to our main HMO tiered options in the network for 2023. It's going to be the same plan design. So we'll have tier 1, tier 2 are out of network. We are using the same New England based network. So it's not just Maine based coverage, it's also coverage in the 6 New England states. As far as bullet 2 goes, there will be $0 preventive care and in some instances $0 virtual care, whether you're using our virtual care tool on the Sydney Health app, or if it's using Live Health Online and seeing virtual doctors via that avenue. We'll also offer some $0 commonly used prescription drugs, typically generics. And we can flip over to our next slide, please. As far as the main HMO tiered options network, my email address will be available at the end of the Anthem specific slides here today. I will be able to provide anybody with our 2023 individual marketing materials. We also have a marketing brochure around the main HMO tiered options network. It's kind of hard to see here on the slide, but this is just a main specific map with all of our tier 1 providers and our tier 2 providers. I do see that someone's asking how they get the slides. I do believe the slides are going to be sent out to everyone after the presentation today. So you all will receive the slide deck, so you'll have that as backup as well. As you can see on the left-hand part of the slide here, there are providers and services allowed in New Hampshire, Connecticut, Vermont. Typically those 3 states. Most of the providers that are contracted with our main HMO tiered options network are in tier 2. For Rhode Island and in Massachusetts, depending on the provider contracting setup, there are tier 1 and tier 2 providers in both of those states. We can hit the next slide, please. As far as some of the detail here on this slide, we will have, similar to 2022, we will have a couple of Anthem Smart Rewards in terms of if an individual actually has their annual in-person wellness exam within the first 90 days of January 1st, they get a $25 digital gift card. So that's an incentive for them to get in to see their PCP and have their annual wellness exam. And then we also offer a $20 digital gift card for completing an online health assessment via the Sydney Health app. So that's something that's going to stay static from 2022 to 2023. As far as what I just talked about, the Live Health Online visits, the virtual visits for non-HSA plans are offered at a $0 copay. And if a member is enrolled to an HSA-based plan, that would be subject to deductible first. And then once deductible is met, the $0 copay would set in on any Live Health Online type virtual doctor's visits. Something that's actually brand new for 2023 in the middle part of this slide in the light blue text, we are adding or marketing 4 new PPO individual plans for 2023. Our PPO network is our nationwide largest, most vast network, and we've never offered PPO in the individual market prior to 2023. So it's a pretty big change and a pretty big enhancement to offer this separate set of plans and also offer this nationwide network. There's several pieces here or details here in the bullet points around the PPO network. If I remember correctly, I believe that it's around 97% of facilities across the US participate in the National Blue Card PPO network, and I think it's 95% of doctors and specialists. So it's a very viable network, if you will, all-inclusive network of providers across the country. So that's something for your individuals that might travel out of state a lot, or they have a second home in Florida, things like that. They might want to consider enrolling in a PPO plan so that their coverage kind of travels with them across the country, wherever they're living or staying or vacationing, things like that. As far as the last two bullet points here on the slide, it just talks about the increase to the non-HSA out-of-pocket maximum for 2023. That maximum jumps from $8,700 to $9,100. And then the HSA out-of-pocket maximum as far as for HSA plans goes from $7,050 up to $7,500. So just a couple of points there around how the maximum amounts are climbing from 2022 to 2023. We can hit the next slide, please. As far as the pharmacy level details go for our plans, we will continue to use our RX Choice tiered network. So pharmacies across the state of Maine will continue to be tiered, whether they're tier 1 or tier 2. Most commonly, what I think you're going to find, we do have a listing of the pharmacies and how they're tiered on anthem.com. I can send you those details if you shoot me an email and you'd like to find those details as far as who's tier 1, who's tier 2. For the most part, the big hitters, Hannaford, Walmart, CVS, those are going to be tier 1 pharmacies. Tier 2s are your Walgreens, Rite Aids, things like that. And again, there's an all inclusive list at anthem.com that I can share with you if anybody reaches out to me directly. The last part of that, can you just go back to that slide that we were just on? This last piece on this particular slide just talks a little bit more about what Kate was talking about earlier in terms of merging the two markets, the small group and individual markets. Basically, it's what the Bureau has told us as carriers is there has to be the same kind of plan design offered in both market segments, whether it's the small group market or the individual market. There will be both plans included on either side of the fence, whether you're a small group employer or you're an individual seeking a plan. Those plans have to be made available in either or market segment. They don't have to be marketed. There is a piece here in the paragraph here below that talks about carriers choosing which plans to market and not to market. So that's an important piece. But on the next couple of slides, I will speak about our marketed plan offerings for individual. So we can hit the next slide, please. As far as our 2023 main individual plan designs for the HMO tiered options that I was talking about, we will offer 17 distinct plans. They will include that RX Choice network. We will stick to our individual select drug formulary. We'll also have the optional home delivery program where if folks want to order their meds online and receive them at their home, that optional home delivery is included with the drug card. And then as far as our individual foundational package, which we've had in the past, as well as our Smart Rewards program, which I talked about previously, those will still be included with our individual main HMO tiered options plans. Next slide, please. As far as those 4 PPO plans that I talked about, those will be on and off exchange. Again, they do have a much broader network than our HMO plans do. It's a national network. There's also out-of-country coverage offered with our PPO plans. They include site of service benefits, the full Blue Card network that I spoke of earlier. It's got the same pharmacy network that our HMO plans share, the RX Choice tiered. It's the same select drug formulary that we offer on the HMO plans with optional home delivery. And it offers the same foundational package that I talked about earlier with the Anthem Smart Rewards. And we can hit the next slide, please. So as far as Medicaid goes, there is, and I'm not sure if everyone's aware of this or not, but there is something going on where some Medicaid members will be losing their coverage as the pandemic kind of comes to an end. In you know, the feds kind of come to an end on the whole emergency order that's out there because of COVID. There are going to be, I forget the total number of individuals that will lose Medicaid coverage coming up in the next few months. But it really brings up an opportunity, especially here in Maine. We're hearing that potentially 40,000 Medicaid enrolled members may be forced off of Medicaid and might be flooding the market here in Maine. So that's a pretty big number of people that potentially could lose coverage, their Medicaid coverage, and be seeking coverage, whether it be in the individual market, on the marketplace, trying to go back to their small group employer to see if they can get coverage through their group plan. So I just wanted to put that out there as an FYI for everybody on this call. We will at Anthem have a marketing strategy to try to let people know about Anthem's plans that are available out there for sale. We're going to try to get some marketing on, I don't know if we're going to do media marketing, radio marketing, and employer drops, things like that, chamber drops. But we will be putting some marketing material out there in the Maine market very soon in regard to this Medicaid process and the potential of some people losing their Medicaid coverage moving forward. We don't have an exact timeline of when that's going to occur, but it is going to be coming down the pipeline. So that's why I included this particular slide here. I think I just saw something come up in chat about Maine Health and our agreement with Maine Medical to keep them in our network. That has been resolved. The provider contracting area at Anthem and the folks at Maine Health did come to a finalized agreement on that provider contract. So Maine Medical Center will remain in all of our networks here in Maine, whether it's the Maine HMO tiered network, our Blue Choice PPO network. They will remain in our networks, and they do remain, as far as tiering goes, they remain a tier 1 provider in our Maine HMO tiered network. So that just wanted to pass that info along to you as well. The last slide that I have today, and I know we need to keep moving things along, we do have a marketing piece. We have it here on the slide for you. It's an Anthem Navigator resource tab, and there are several links within this particular slide where you can grab Anthem individual and family plan marketing materials. There's a tool on quoting and enrollment. Our Anthem Broker Hub is actually where a lot of our broker-based marketing materials are housed. So this is a great slide for you to keep handy for open enrollment throughout the 2023 plan year, and refer to it often because it's a great resource in regard to our 2023 Anthem plans and marketing materials. So with that, I will end the Anthem segment of today's show. If I see any questions come in through chat, I'll do the best I can to answer those. My contact information is listed here with my counterpart, Jessica Sampson. So both of our email addresses are listed on this particular slide here. So jot those down. And if we can help you in any way in terms of grabbing marketing materials, product slides, things like that, just feel free to reach out. Thank you.
Thanks, Dan. Next up, we have Christy Pendexter from Community Health Options.
Thank you, Heather. Good afternoon, everybody. Again, I'm Christy Pendexter with Community Health Options. I'm a benefits consultant. I work in the individual and small group market. I initially started with Community Health Options back in 2014. On slide 1, we've actually gone through a bunch of this already. The only thing I did want to mention is the extended tax credits. Those will continue through 2023 due to the Inflation Reduction Act. And we've talked about the merge market, pricing changes, standardized plans. So we can move forward to the next slide. After obtaining member feedback, we have added several new and expanded product features. We're adding a digital wellness engagement platform and a mobile app. CISP, which is our chronic illness support program. There's another slide in here that goes over that in more detail. That's now going to be included in all of our plans, non-HSA plans. Last year, it was included in only a few of our products. Adult vision exams are now going to be included in all of our plans. We're expanding the provider tiering in HMO tiered products and preferred providers. $5 copays for tier 1 generics is now on all non-HSA plans. Members pay $0 cost share on non-HSA plans for urgent telehealth via Amwell. HSA plans pay a flat $64 before the deductible and a $0 copay after deductible. Next slide. This talks about our new tiering structure. So basically, when you go to our website, which I would suggest going to the website, looking up providers, there is going to be a star that notates which is a preferred provider versus a standard provider. I realize that that is going to be available on Cover Me as well. Some things to note: a preferred provider may be at one location and not another. Preferred and standard accumulators have been introduced. All claims for preferred providers will be applied to the preferred deductible and both the preferred and standard out-of-pocket maximums. Next slide. First PCP visit and first behavioral health visit annually has no cost share in non-HSA plans on and off exchange. All subsequent co-payments are applied to the deductible. We have removed the tobacco rating for 2023 for the merge market plan. So this year for 2022, smokers were rated. We are taking that away for 2023. We have 25 plans on and off exchange. We also have several different network types, which I'll go over these in more detail on a further slide. New HMO plans for individual HMO New England, HMO tiered New England, and HMO national plans. And I'll talk more about that later. We also are introducing the HSA Plus plans and Healthy Main plans. The HSA Plus plans, anything that says HSA Plus includes a preventative drug list. And what that means is for any of the drugs that are routine preventative drugs, it bypasses the deductible for those prescriptions. And it's notated on our formulary. Anything that says HSA next to it would include that preventive drug list. We're also introducing the Healthy Main plans. These plans they're created for people who are relatively healthy. They want to stay focused on their wellness and purchase insurance for significant health events, but really use their health plans for sick care. Many of the provider visits in RX have a copay with no deductible and immediate access to wellness benefits at $0 cost share. There's a digital wellness engagement platform and mobile app offering education challenges, incentives for the entire family, 18 plus, at $0 cost share. Unlimited personalized health coaching, telehealth for behavioral health and $0 cost, urgent care telehealth through Amwell, and acupuncture reimbursement with no deductible. Next slide, please. Thank you. This just talks more about the health coaching for the Healthy Main plans. It just gives you some details as to what's offered. So smoking cessation, nutrition, emotional well-being, sleep hygiene, fitness, finding your purpose, weight management, family relationships, occupation, prenatal health, and finances. And this is going to be available through your phone or email, and they will have access to those health coaches. And this is just more information on that wellness platform. This can be found through their member portal. So once they become a member, they log into our they go to our website, create their member portal, and that's where they'll be able to access this. And they'll also be able to access through a mobile app. And these are some of the wellness challenges that they would be able to participate in. And this is what I spoke about earlier. It's available through their mobile app. They'll receive text reminders. And our provider network, so you're going to see a lot of HMO, or you'll see a New England or a national. Our New England is our primary network, and our primary network includes Maine, New Hampshire, bordering Vermont and major hospitals in Massachusetts, such as Dana-Farber, Boston Children's. That's all part of our primary network. So anything that says NE next to it, that's part of that network. If it's a PPO, you obviously have benefits outside of the network at a higher deductible and out-of-pocket max. And then the HMOs, you would need to stay within that New England network. We also have plans that say national. What that means is if you enroll in a national plan and you want to see a physician in New York, if that physician is part of our First Health, it's our WRAP network. If that physician is in that network, they're going to receive in-network benefits out of state. Next slide, please. And this talks about some of the hospitals that are in network in our primary New England network, located in Massachusetts. So that's just a list of those. And this just talks about our member service, our member survey results. We have earned a 4-star quality rating in our 2022 Qualified Health Plan Enrollment Experience Survey. And we also earned 5 stars for plan efficiency and 4 stars for clinical and quality management. We also have a local medical and care management team, and they assist our members with removing barriers, managing care, and coordinating complex care. And this is a slide relating to the chronic illness support program. Again, this is going to be included in all of our non-HSA plans. And basically what it is if somebody has asthma, coronary artery disease, chronic COPD, diabetes, hypertension, all of their generic medications, as long as they're mail order, will be at no cost to the member. If it's a tier 2 or 3 medication, coverage is at 50% and the deductible is waived. For all of their routine care, so if they go to see their physician for just a well visit for the diabetes, there's no cost share for that member. Next slide, please. And this also talks about the pharmacy. So for any ACA preventive drugs, 0 cost to the member. HSA preventative drug, that's what I talked about. If a plan says HSA, HSA plus, they get the preventative drug list is included in those plans. Insulin, members pay a maximum of $35 for up to a 30-day supply. And then Narcan members pay 0 cost share, bypassing the deductible to reduce barriers in treating opioid addiction. Slide. We also offer a tobacco cessation. So members pay $0 for 2 90-day courses of therapy on selected over-the-counter and products annually. So basically, if a member goes to their doctor and they would like to receive the patch, the gum, any over-the-counter medication, they would get a prescription, take it to the pharmacy, and they would fill that at 0 cost to the member. Blood glucose, members pay $0 for one-touch or freestyle meter through a program directly with the manufacturer using Health Options coupon code. We've already discussed the chronic illness support program, and then our site of care incentive program. Members can receive incentive payments for using preferred infusion sites for select medications. Next slide. And the embedded dental with Delta Dental. So this is just a little breakdown of the plan. It's $100 deductible per child, no family deductible. Members will receive a separate Northeast Delta Dental card in the mail. And then we have provided our individual cell sheet. There is a link here, the 2023 individual plans brochure, and that kind of gives you a breakdown of all of the plans, what's included on a one pager. So the link underneath that actually brings you to the CSR plans, so the cost share reduction plans, that is basically another cell sheet that breaks it down with those plans. And thank you for joining. And my contact information is listed below. Should you have any questions, feel free to reach out.
Great, thanks, Christy.
You're welcome.
Next up, we have Jody from Harvard Pilgrim Healthcare.
Thank you, Helen. Thank you so much for inviting us all to spend some time with you today. I'm always appreciative of the effort that goes into this webinar and super impressed. It's so much information, and I just give you kudos for all the work that goes into it. I want to pause before I jump into anything that is plan specific and just talk about Harvard Pilgrim, a Point 32 health company, to discuss our presence in the community. I think it's nice for us to share what we do outside the scope of health insurance once in a while. Obviously at Harvard Pilgrim, we're firm believers in giving back, whether it's in the form of grants, sponsorship, or even volunteer hours given by our employees. There we go. Thank you. Read my mind. And this is just a snippet. This certainly isn't a fully comprehensive list of anything, but in 2021, we gave $16 million in grants, matching gifts, sponsorships, in-kind and other contributions to support nonprofit organizations. The bottom line speaks to me. Our employees gave over 5,369 volunteer hours. And some of the other examples of our community relationships are the American Heart Association, the Good Shepherd Food Bank, the Mid-Maine Homeless Shelter, and more. So with that, I will jump into some plans specific information. But if anybody does have any additional questions or wants to kind of research what we do in the community, you can get that information at point32healthfoundation.org. So let's talk about what's new. This is definitely not going to be a fully comprehensive list of everything that's new because, as we all know, and as the other carriers have mentioned, we just have so much going on this year. But these are things that I know will speak to you because they're things that we've talked about in the past, and they will affect choices that members are making when they're enrolling or re-enrolling in the plan. So we do work with two different HMO networks. We have our HMO Open Access Network, and we have our Maine's Choice Plus HMO network, and that's our tiered product. And I wanted to point out this year that we are actually moving some of our standard tier hospitals in Massachusetts into our preferred tier. So this is going to include Boston Medical, Tufts Medical, Leahy Clinic, just to name a few. Obviously, we've updated the provider directory that you can find online at the public website. Full disclosure, I immediately point out those that are staying in the standard network because this is the question that I get almost immediately when I bring this up. Dana-Farber, Boston Children's, Mass General, they will be staying in network, but they will be staying in our standard tier. So nobody's leaving, we're just kind of shifting things around a little bit. Next slide. When I talk about Maine's Choice, I always like to talk about benefits that will always be considered preferred. So this is something that the member doesn't have to think about. These benefits are always going to fall in the preferred category. Things like acupuncture, chiropractic care, hearing aids, mental health, drug, alcohol rehabilitation services, always will be covered as preferred. Next slide. Another significant change for us this year, and I think that this is a good one. OptumRx is now a fully integrated, or will be rather, a fully integrated pharmacy benefit manager for us. What was, or this year currently is CVS Specialty, is transitioning to Optum. This change will take place on January 1st. With minimal disruption to the member. They are going to receive 60 days notice of this change. In fact, I think I've seen that those notices have gone out. Any existing prior authorization that we have on file or any open refills are going to be transferred by us to Optum. So there's no additional legwork that the member has to do with regards to this change. I also know there is some targeted outreach happening with members with regards to this change. I don't believe it's every single member that may receive that type of one-on-one phone call outreach, but there is going to be some targeted outreach with regards to this as well. Next slide. So as everyone mentioned, we all have core health benefits built into our plan. They're the things that you should expect from your health insurance carrier. Some of them may differ from carrier to carrier, but these are our list of core health benefits, certainly not completely comprehensive, but we do include acupuncture and chiropractic care on all of our plans. One eye exam or one preventive eye exam every year. Obviously, routine physical exams will be covered, lab services, rehab services, and so on. Also, pediatric vision hardware is covered for children up to the age of 19. Next slide. So some value adds, and I have subsequent slides that will speak a little bit more to each of these, or at least some of these, but site of service benefits are available on most of our HMO and HMO Choice Plus, Maine's Choice Plus HMO plans. The names are getting really long, you guys, for these plans. Even on some of our bronze plans, we have an over-the-counter medication benefit. We have, as I just mentioned, the one exam every 12 months for eye exams. Eye exams are also covered in full on all of our HSA compatible plans. We have a lower deductible HSA option available both on and off the marketplace. And as I referenced, acupuncture and chiropractic care is covered with all of our plans, and it is an unlimited visit benefit. Next slide. So site of service benefits, someone's probably going to call me wrong on this. I believe we introduced this last year. Everything starts to blend after a little while. But this is one that I really do like to talk about. So the site of service benefit actually costs the member less if they seek the service that we've listed in a freestanding or non-hospital based facility. So for example, a member needs so it is specific to these 4 categories here. So labs, day surgeries, PT, OT, ST, advanced radiology. If a member seeks this service in a non-hospital based facility, I'm thinking, so let's say Convenient MD, as opposed to seeking that particular service that they're seeking in a hospital, they may have will have a copay associated with that visit, as opposed to having that visit subject to their deductible and/or deductible and coinsurance. The site of service benefits do not apply to the 9100 Bronze Clear Choice, HSA, or catastrophic plans, but are included in all of the others. Next slide. So I also mentioned in the value adds that we do have an over-the-counter medication benefit. The over-the-counter medications include things like your cold and allergy meds, your gastrointestinal medication, pain and anti-inflammatory. Essentially, let's use Zyrtec as an example. Very expensive allergy medication. If a member needs to take Zyrtec, they can actually get a script from their PCP, and standard tier 1 cost sharing will apply to the cost of that, as opposed to being $30 or whatever. It will be the copay for that amount. Maybe that wasn't the best example, but it's the one that I thought of. And a 90-day script does apply. Next slide. So we all talk a lot about living well and being well, and it's, everybody's trying to be their best selves. And these are programs that are built into every single plan that we offer at no additional cost to the member. The first one is Living Well Every Day. It's basically a free online community packed with activities, tracking tools. There's all kinds of challenges, gift card drawings and things of that nature, kind of to keep you engaged and being your best self. Lifestyle management coaches, all of our members also have access to certified lifestyle management coaching. They can help you set goals for yourself. They can help you achieve those goals and do regular check-ins with you to see how you're doing. All of our members also have access to a clinical care team support. If they need assistance managing a chronic condition, they have access to that, someone who can help them understand the cost of their care, coordinate care, and answer questions about their benefits. So These are programs, again, at no additional cost to the member. They're built into every single one of our plans. Next slide. And this is just a snapshot of the Living Well Health Portal that I mentioned. So this is where the member would log into this health engagement portal. And again, it includes rewards and incentives, access to health coaching, information on holistic programs, and more. Next slide. The health coaching I referred to as part of this Living Well initiative, phone-based support and guidance for, certainly, again, not a fully comprehensive list, but things like controlling blood pressure, reducing stress, and finding balance, improving sleep. Members can self-refer for a health coach, either through the Living Well portal, or they can reach out via the phone number we've listed there. Next slide. And at the top of everyone's mind, I think, or certainly very close to the top, behavioral health and substance abuse disorder support. Behavioral health is certainly a hot topic. And we have several ways in which a member can gain access to assistance. We have the 24/7 support helpline, providing substance use disorder treatment and emotional support. We have licensed care advocates available to help members find providers and answer questions for them about benefits that are available to them in order to help with these things. We have peer coaching available for substance use disorders, and we have several different tools online. So not just the Live and Work Well website, but we also have Talkspace, which is digital therapy, and Sendvello, which is a mobile app. And of course, we have our virtual visits with Docs on Demand, which I think I do reference on the next slide. So more great ways for members to save money, because we all are looking to save money. Docs on Demand was introduced a few years back. This is our telemedicine or virtual visit care. It is, again, available to all of our members at no additional cost. It is a great resource for anybody who might be traveling, or maybe you have a child who is going to school out of state. All urgent care virtual visits with Docs on Demand providers are at no cost to our members on non-HSA plans. And I know that there is a cap on the amount that a member will pay if they're on an HSA compatible plan, and at the moment that amount escapes me, and I apologize, but I can get it for anybody who needs it. We also have wellness discounts and savings programs. All of these different programs, as you can see, also have their own link on our website. But these discount programs help with things like vision and hearing costs, holistic wellness, smoking cessation, and so on. We have the Reduced My Cost tool. This is a tool that can be used to help someone find and schedule care with a lower cost provider. So you can use the website, a member can use the website for that, or they can actually call in and speak with someone to seek help. And we also still have our fitness reimbursement program. The fitness reimbursement is $150 per year for a member, or up to $300 per family, for not only gym memberships, club memberships, but also virtual fitness memberships. It's a really easy reimbursement process. You can find the form on the public website, or you can work right through your member portal, or the member can work right through their member portal to work with some member services to seek reimbursement. So again, that's up to $300 per family. I know the next slide is my last slide, I think. I always follow up after this webinar with all of the important links that I think you need. I also include our product guide. Our product guide has a lot of the information that I did cover today already, but it also obviously has all of our products in it. So it speaks to our networks, the products, of course, all of those value adds that I just talked about, all of the different programs, the drug formulary, which is still our value 5-tier drug formulary, and probably a zillion other things that I'm not thinking about talking about right now. But that is it for me at the moment. Thank you.
Thanks, Jody. Next up, we have Connor Allen from Tarot Health.
Hey everybody. Thank you very much for taking the time out of your lives to really do this sister work. I think at Tarot, we really recognize that this is an incredibly valuable service you guys do. I think I remember the first time I had to buy health insurance and I was like, this is the most complicated thing in the world. And I work in health insurance. And so we really appreciate the work you guys do. And you make it a real impact on people's lives. They make one of the most important decisions they're going to make each day. So anyways, thank you for coming to our training. Helen, if you want to go to the next slide. I think goals for today for us from the Tarot side is one, just want to give you guys a background on Tarot Health. Obviously, we're a brand new carrier in the market. Want to make sure you understand kind of what makes us different. I think the second thing is we'd want to teach you guys about why we think direct primary care can be a really transformative experience for the people you help, and how every person who you help will be able to receive a direct primary care membership with a Tarot Health plan free of charge. And I think the final thing we want to do is just walk through our plan benefit designs that we'll offer. I think we approach things philosophically a little different. We want to kind of walk you guys through why we have built our plan designs this way and why we think it can be really beneficial to the people you assist. Helen, next slide, please. So I think maybe taking a step back at a 1,000-foot view, like Tarot's core beliefs, I think one, we believe that primary care is the root of positive healthcare engagement. And what we mean by this is that we really feel that true positive engagement with the healthcare system is going to derive from a really strong relationship with your primary care physician, and really having a primary care physician who is the primary point of care, not just simply your entry point into the broader healthcare system. I think the second thing that we believe is that patients deserve access to a personalized healthcare experience. When I think of a personalized healthcare experience, what it really means to me is it's like having a doctor in the family. Growing up, my aunt was a physician. We were always able to go to her with any healthcare issues that might emerge, call her on weeknights or weekends, get medical advice. She really knew us, knew all our sports activities, everything else like that. So she could really give like more personalized recommendations. My father has had his sister write his prescriptions for years. And there's really just this personal relationship that exists between, my aunt and my family, obviously, because it's my aunt. But like, I think we fundamentally feel that like everyone deserves this type of personalized healthcare experience, not just people like lucky enough to have a doctor in their family. And I think the third thing that we believe is that people will proactively keep themselves healthy when costs are clear. And I think like the point here is we feel that health insurance has gotten much too complicated for the average person. It's way too difficult for them to understand what things are going to cost. And they don't engage with their health because they're scared of going to the doctor because they're not sure what it's going to cost. They might have a 40% coinsurance, but they don't know if that's going to be a 40% coinsurance on a $100 bill, a $500 bill, a $1,000 bill. As a result, they refrain from actually engaging with the healthcare system. As a result, their health deteriorates and they end up living like more unhealthy, worse lives. And so we really think that by making costs clear, you can get people to proactively engage with their health and as a result, keep themselves healthier. Helen, if you want to go to the next slide. Oh, one back, perfect. So, Tarot Health is coming to Maine in November. We're really excited. We're a new health insurance carrier coming just for 2023 to Cumberland County. I think the hope is over time to expand into the rest of the state, but in year one, we'll just be in Cumberland County. We're going to offer both the Tarot Health custom direct primary care plans and clear choice plans on coverme.gov. I'm going to spend the majority of this kind of 10 minutes here talking about our custom direct primary care plans because they're kind of our unique differentiator. And I think you guys are broadly aware of what the clear choice plans look like from the other carriers. I want to really make sure you guys understand our custom DPC plans. We're also available for small group, just an awareness for you guys. But I know your focus is really more on the individual market. I think, as I mentioned, we bring a really unique primary care model that will give all Tarot Health members unlimited access to concierge level care for $0 cost. I think we really think of this as the core differentiator of what we're bringing to the market and really what makes us stand out. And I think the last thing to note really at a high level is just that we've partnered with Maine Health to offer access to all Maine Health specialists, doctors, hospitals, and facilities to Tarot Health members. And so, Tarot Health members who live in Cumberland County, will have access to Maine Medical Center and all the other Maine Health facilities. I don't need to worry about that. We have a really strong relationship and partnership there with Maine Health. Helen, next slide. So I think, talking a little about direct primary care and kind of educating you guys on what it is. I think on the Tarot team, we talk a lot about direct primary care as the return to the way medicine used to be. And what we mean by this is if you think back, 50, 60 years ago, there was like a town doctor who would give birth to you, who was your pediatrician growing up, who provided family medicine services to your entire family and the entire town. And frankly, like 90 to 95% of medical services were delivered by that town doctor. And only in the most specialized cases did someone have to go to the hospital and receive more kind of advanced specialized care. And over time, obviously like primary care physicians' roles has declined from that to be more of the entry point of the healthcare system. But I think we look at direct primary care as a really return to this way medicine used to be, where the primary care doctor really acts as the primary point of care. And so, Helen, if you go to the next slide. If you look at kind of traditional primary care, and by traditional primary care here, I mean, primary care as it exists today at an Intermed or at a Northern Light or at a Maine Health, primary care doctors really treated as the entry point into the broader healthcare system. Their focus is really on seeing as many patients in a day as possible, triaging them as quickly as possible, getting the patient in and out the door, and either send them along and referring them out to a specialist where they can actually receive medical care, or sending them home because there's no treatment required. And I think as we compare that to direct primary care, really in the direct primary care model, primary care is really the root of someone's healthcare experience. Once again, like it is a place where the direct primary care physicians actually deliver really high quality personalized care. And the referring out to specialists only occurs when absolutely necessary. I think our direct primary care physicians often say, 90 to 95% of medical services can be done at the direct primary care level when there is the time to actually deliver the care. And so, you really eliminate a lot of the need to go see specialists and all these other additional costs of care that emerge. And so ultimately what this creates in terms of key benefits to patients is, one, reduced medical expenses. This is because you're going to specialists less. So you're having a copay or a cost of a visit to go see a specialist. You're eliminating those. You have easy access to your doctor. All direct primary care physicians offer same or next day access to their patients. So instead of having to go to an urgent care or having to go to an emergency room, like you can actually go in and see your primary care physician, and they can actually deliver treatment for you as you deal with acute issues. I think second, you're going to live healthier lives because the engagement at the primary care point of view, it's a doctor who truly knows you, knows your entire life, has spent the time to get to know you. And they can actually provide medical treatment that is tailored to you as an individual and your individual life, so that you can actually live healthier lives and engage with the things that make you, you. And I think the final thing is really this idea of personalized healthcare. Like these doctors really get to know you. They have the time, they know your entire family, and they're able to actually deliver this care that's tailored to you as an individual, instead of just the standard cookie cutter care that they would have to deliver to the patient they see for 5 minutes as they go on to the next one. So I think we really look at this as a transformative experience. And Helen, if you go to the next slide, I want to try to quantify some of these differences. So I think in the direct primary care versus the traditional primary care world, in a Taro Health, with a Taro Health direct primary care doctor, the cost per visit for every single visit, not just the first visit, but every single visit with your primary care doctor is $0. When you compare that to a traditional primary care model, where maybe the cost is $75 to $100, like significant savings are already being driven for people by just having free primary care. When you talk about the time spent with the doctor, you're talking about a 45-minute on average visit length compared to 5 to 10 minutes. And once again, that time is actually time where true treatment can be delivered at the primary care level. So not only are you receiving the visit for $0 cost, but you're avoiding having to go to follow-up visits with a specialist. Time until appointment, once again, a huge one. The average time until appointment with a Taro Health direct primary care doctor is 1 day. And with a traditional primary care doctor, you're talking 2 weeks in a best case scenario. With a Taro Health plan and with access to a Taro Health direct primary care physician, you can actually get in to see your doctor significantly easier than with any other plan on the market. This is really all driven by this patients per doctor number. A fully ramped up Taro Health direct primary care doctor might see about 500 patients, and you compare that to a traditional primary care doctor who sees 2,000 to 3,000 patients. It really is as simple as, if you're seeing 1/5 as many patients, you're going to have 5 times as much time for each patient, and you're actually just able to deliver a higher quality, better care for each member. Obviously, both direct primary care and traditional primary care offer in-person office visits, but I think the core differentiator with a Taro Health direct primary care, or another core differentiator with the Taro Health direct primary care doctors, is this ability to text or call your doctor in between visits. I often share the anecdote that, I'll be out to dinner with one of our direct primary care physicians, and we'll be in the middle of a conversation, and they'll say, "Hey, hold on 1 second. Like, a patient's calling me. I'm going to go take this." Or, "I got a text from a patient. I'm going to respond to this." And because they actually know all their patients so well, and they know their medical history, and they've spent the time with them, they can deliver the care over the phone without needing to pull up their medical records, because they actually know each of their patients. So you really are talking about a truly personalized healthcare experience with a doctor who knows you, who has time for you, all at $0 cost for a Taro Health member. And I think the other important thing is like our plans are similar cost to the other plans. So you get this incredible concierge level primary care experience for no additional cost for each member. And the time, over what period of time, that's just an entire patient panel, Linda. In a typical health systems construct, they'll say a primary care physician is responsible for 2,000 to 3,000 patients over the course of a year, basically. They might see some of them once, they might see some of them 3 times. It's really just the entire panel size that a doctor is responsible for. And the point is really that a Taro Health direct primary care physician sees 1/5 as many people, is responsible for 1/5 as many people, and therefore has time for 5 times as many people. Helen, if you could go to the next slide. Also, obviously, look, we feel at Taro that direct primary care and this really high touch primary care experience is the core differentiator of what we're bringing to the market. But obviously also very important to touch on kind of what the network looks like beyond direct primary care, as well as kind of more of what plan benefit designs will look like as well. So Helen, if you want to go to the next slide. So our core network partner is Maine Health. We have a really strong partnership with Maine Health that we're incredibly excited about. All Taro Health members will receive specialist emergency care, all hospital facilities, all Maine Health facility access, including Maine Medical Center in Portland. And I think we're really excited about the Maine Health partnership. I think we look at them as a core partner, and they've really engaged with us in trying to find unique ways to deliver care to the members of the community. And so I think we're really excited about continuing to build on that relationship with Maine Health. And I think with Taro Health members, like they can be confident that all the Maine Health facilities will stay in network with us long-term in Cumberland County. In addition to that, we have our WRAP network via Multiplan PHCS, which gives us access to additional specialists and hospitals throughout Maine, gives us access to specialists all throughout Cumberland County, as well as hospitals in the northern part of the state as well. So if anyone's kind of on vacation up in the northern part of the state, there are plenty of in-network hospitals there as well. In addition, probably less important for like a member level, but just for awareness, like we do offer a fairly robust nationwide emergency network for anyone who runs into any issues that can land like kind of in an in-network emergency facility, obviously with emergencies also, like that's always covered, but just want to note really the Multiplan PHCS network, just this real broad access to additional specialists and hospitals in Maine. Helen, next slide. Now diving into our plan benefit design beliefs, I think like taking a step back almost, like our philosophy is that members will engage with their health more proactively if they know how much it will cost them. And I think the approach we've taken on this is really, co-pays on proactive health services. You'll see our plan benefit designs and realize like we've taken a different approach than any other carrier, because we have tried to make it so that 95% of healthcare services that Taro Health members will engage with will have a very clear copay, so they know exactly what it costs for them to proactively engage with their health. Helen, if you want to go to the next slide. So here's what our plan benefit designs look like for our custom DPC plans. So on our bronze plan, our deductible is $9,100 with a max out of pocket of $9,100. It's a $0 copay for primary care, and this is the concierge direct primary care membership that everyone gets. It's a $0 cost for every single visit. In addition to that, we have a $0 copay on all mental health visits, not just the first one. We have an up to $20 copay on generic drugs, and up to $150 copay on labs, x-rays, diagnostic imaging, specialist visits, speech and physical therapy, and up to $350 copay on imaging, and up to $100 copay on urgent care, and a $0 copay on all teledoc visits as well. I want to note also with teledoc that we have teledoc access for mental health visits as well. So people comfortable seeing a mental health provider kind of more in a virtual setting will be able to see mental health providers via teledoc, which would significantly increase the access to mental health, because I know the people in Maine, really struggle with mental health access currently. On our silver plan, we similarly have a $9,100 deductible and max out of pocket with a $0 copay once again on the direct primary care membership. $0 copay on all mental health visits, $0 copay on generic drugs, $0 copay on labs, and up to $150 copay on x-rays, diagnostic imaging, specialist visits, speech and physical therapy, and up to $250 copay on imaging, up to $100 copay on urgent care, and that $0 copay on teledoc. All other services are deductible out-of-pocket max. And our gold plan, on note, we're actually the only $0 deductible drug in the state, and with a max out-of-pocket of $9,100. And this includes a $0 copay on primary care, once again with the direct primary care model, a $0 copay on all mental health visits, $0 copay on generic drugs, $0 copay on labs, $0 copay on x-ray and diagnostic imaging, and up to $75 copay on specialist visits, and up to $75 copay on speech and physical therapy, $200 copay on imaging, a up to $100 copay on urgent care and a $0 copay on teledoc with a 50% co-insurance on all their services. And so I think we look at this and say 95% of healthcare services are captured here with really clear copays. I see Katie in the chat has asked a question about specialty drugs. So our brand drugs as well have copays. And I believe it's a $200 copay on our bronze plan, a $150 copay on our silver plan, and a $50 copay, I believe, on our gold plan. And so there's a clear copay on brand drugs as well, for certain, like, and then those are for tier 1 and tier 2 of our formulary, which is preferred generic tier 1, preferred brand tier 2, non-preferred brand, non-preferred generic do not have copays, neither do specialty drugs, and then we have obviously the ACA required coverage as well as tier 5 of our formulary. So hope that answers the question there, Katie. Helen, next slide, please. And then our plan benefits with cost sharing reduction. I'm not going to run through each of these individually, but I think the general point here obviously is that with the enhanced subsidies and the cost sharing reduction, the deductible and max out of pocket goes down in all of these incrementally, the copays go down. And I think I want to make a philosophical point there that for people who qualify for additional cost sharing reduction, like these are the people who are living the most paycheck to paycheck, who medical expenses are a really big deal for. And the clarity in cost for those people will be a true differentiator, because for them, actually knowing exactly what it's going to cost for them to go to the doctor is going to be transformative in their willingness to actually proactively engage with their health and go and see a doctor. So I think we really look at these plans, these cost sharing reduction plans, as for people who qualify for them. The Taro Health plan, including like the really high touch personalized primary care included for free, but on top of that, free mental health, free generic drugs, free labs, depending on the cost sharing reduction, potentially free x-rays as well, low copays on specialist visits. On that is truly transformative for those people who are looking to who are having to manage day to day their budgets, and like every cost matters. So I think we really think that this can be a really strong option for people who qualify for the additional subsidies. Helen, if you could go next slide, please. I want to note here, because there is some complexity around our plans, these custom plans versus clear choice plans. So our custom direct primary care plans include a primary care network of independent direct primary care physicians. Our clear choice plans include a primary care network of more standard traditional primary care physicians. All Maine Health, for instance, in the clear choice plans, all Maine Health primary care providers are in network there, but in our custom direct primary care plans, it'll just be our independent direct primary care physicians in network. I think this is important for you guys to understand as you kind of help people navigate the different Taro Health plans, that if you sign up for a Taro Health custom DPC plan, you are going to have to pick from one of the custom direct primary care, the like independent direct primary care providers, and you likely will be transitioning primary care physicians as a result. I also want to note just generally, like we are trying to change the way people engage with healthcare. Clearly, like we have a big vision, and I think we do feel that this requires specialized plans that incorporate direct primary care. I think, as I've mentioned, like we think direct primary care is frankly transformative in the healthcare space, and every single person could benefit from it. Unfortunately, the reality is that we can't make the direct primary care plans fit within the clear choice plans. It's really as simple as you just need a $0 copay on primary care for direct primary care to work at its full effectiveness. And that's not possible within a clear choice plan. So we'll have the required clear choice plans in the marketplace. I think for people who are looking for more of a standard healthcare experience, our clear choice plans are really strong options. But I do think our focus is really probably on our innovative specialized plan designs that incorporate direct primary care. Helen, next slide, please. We've named our plans in a way that should make it very clear which plan is which. And so our direct primary care plans are the ones on the top that have $0 direct primary care in the name. Should make it very simple. Taro Health, Bronze, Specialist, Saver, $0 direct primary care. And then our clear choice plans, obviously, like all other plans, have clear choice in the name. And this should help you when you navigate people about picking the right Taro plan for them. If they want the direct primary care model, make sure they sign up for the ones with the $0 direct primary care in the name. If they want the standard primary care model, make sure they sign up for a clear choice plan. Helen, next slide, please. And so I think, high level takeaways, I hope the takeaways are one, Taro brings a friendly, easy to use health insurance product that will cover the people you're helping's needs. I think two, hopefully you understand that Taro brings this really personalized primary care experience with a physician who actually has time to get to know their patients at no additional cost to the people you're helping. And at three, I hope you think that, we offer really fair and affordable prices and clear copays from a really high quality network of providers that will be able to deliver the care that the people you're helping need. Helen, next slide. I think the last thing I'd love to leave you guys with is we do have this video of a patient talking about their direct primary care experience. I think it really encapsulates what's unique about direct primary care and the impact it can have on an individual's experience. Helen, if you could just click the link, that'd be great. Helen, I think the sound is muted. Yeah. And if we could just start the video over. Helen, you might need to unmute your own video, Helen.
You need to share sound. Sorry, Connor, I didn't realize this was in here. We didn't prep.
Oh, no worries, no worries. This is the reality. Look, we have
where insurance fits in healthcare. I'm very excited.
That's great. Can we start it over again, please, Helen?
Yeah, Helen, can we start it over, please?
Directly with direct primary.
Okay. So what do you all need me to do?
Just back it up to the beginning.
Yep.
Thanks so much. So we can hear it. That's good.
So
hit play.
Play button. Here we go.
Yes, okay. Care is where it all starts. It's the foundation. From my first visit, I knew that it was the right fit. She was just so engaging and responsive. I get to meet them where they are and we get to have that conversation so that when they leave, they feel confident. It is just so much better. It's so nice to be able to address all of those concerns with one person. They easily can access me and say, oh, I forgot to ask. And that's not a problem either. So they don't feel alone. They know that I'm there with them. With Dr. Lucas, you have kind of an advocate to help you, and it just feels like you're heard and that you have a part in your own healthcare. Tarot Health is trying to redefine where insurance fits in healthcare. I'm very excited that Dr. Lucas is working with a new insurance company that works directly with direct primary care. This is just such a great model, and it's been such a great experience for me. We have to make a better system, and I'm just really happy to be a part of it.
Cool. Thank you very much, Helen. So yeah, that's tarot. That's what we're bringing to the market. Katie, I saw you'd asked a question about our pharmacy benefits info. If you just go to formulary.tarot.com, you'll be able to see our entire formulary list and be able to search it. And I think, as I mentioned, we have a 5-tier formulary. Tier 1, preferred generic. Tier 2, preferred brand. Tier 3, non-preferred generic, non-preferred brand. Tier 4, specialty drugs. Tier 5, ACA covered drugs. And so Tier 1 is our generic drugs. Tier 2, brand. Tier 3 and 4 are out-of-pocket costs for members, and Tier 5 is the required ACA coverage drugs. Hope that answers that. And yes, there's a pharmacy network. We partner with Smith RX as our PBM, gives access to Walgreens and CVS and main health pharmacies. And also, like, people can search for additional ones. I don't know every single independent pharmacy that's in network, but there's a pharmacy network, and it covers the vast majority of major pharmacies in the country. Cami, to answer your question, no, there will not be any concerns about enrolling in a tarot plan and having no providers taking new patients. I think we've worked closely with the Maine Bureau of Insurance, talking through our providers, their capacity, our enrollment targets, where the Maine Bureau of Insurance expects us to land in enrollment. And there's really no concern about access to primary care physicians and no doctors taking additional patients. So I think that should not be an issue at all. I appreciate the question, though.
Okay, do any others?
Awesome. Well, I think that's all the questions then. I really appreciate you guys taking the time to learn about tarot, and we're really excited about, the opportunity to offer this really personalized healthcare experience to people in Maine.
And actually, Connor, I do have a question for you that came up in the conversation today. Someone who lives in Saginaw County, but has providers in Cumberland County, will they be able to sign up for a tarot plan?
They will not. Sign up is purely determined by resident zip code. So if you just think, when you go onto coverme.gov and you're helping someone enroll, you have to put in their zip code, and it's going to determine which county they're in. We're just available for people whose county is Cumberland
County. Okay, thank you.
And Courtney, you just mentioned your concern would be provider turnover. I would say we'd be very surprised to have any real provider turnover. Most doctors who make the transition to direct primary care never go back. They really love it. It's a lifestyle choice for the doctors a lot. They feel they deliver higher quality care and it's better. I can't think of a single direct primary care physician I've heard of who's made the transition and then gone back to the standard system. So provider turnover should be incredibly low.
Okay.
Helen, I could be like totally interrupting everything right now, but there was a question that I answered in the chat and I kind of wanted to revisit it before I forget to, or it doesn't get addressed.
Yeah.
And the question was with regards to identifying what network our providers fall into. And I took 2 slides out of my presentation this year. And honestly, I should have left them in because I speak to it every year. And the one year I take it out is the year that there's question. So just to revisit, we do work with 2 networks and only one of those is a tiered network. Okay. And that's our Maine's Choice plus HMO, which is the network I talked about today, where we had some hospitals shifting around. My recommendation is this, and it seems kind of fundamental, but it's helpful to point it out. When you're searching our provider directory, you need to be 100% certain you're looking in the Maine's Choice plus HMO directory for the provider you are inquiring about. And when you find that provider, it should very clearly list, and I answered the question as if we were talking just about hospitals, but this should pertain to any provider in that directory. It should clearly list the provider name, and literally the next line should be preferred or standard. So it should very clearly identify what network that provider falls into. So I kind of wanted to give a better explanation of that because I know it came up in the chat and I don't think I did a great job answering the question. And my takeaway is that I'm putting my slides back in next year. So
great, thank you. And
yes,
Jody,
Linda. Yep.
Another question in the chat, when you were talking about the site of service benefit, Harvard's plans, this question, where does outpatient surgery in a hospital go with Harvard Pilgrim?
Yes, that's going to be subject to the deductible. So think of it as it's still being performed in the hospital. So it's going to be subject to, in most cases, subject to the deductible and or deductible on co-insurance. Truly, site of service is, think of the word site and it's something off-site. It's freestanding. It's non-hospital based. So anytime that service is performed in a hospital setting, it's going to fall under those hospital rules. Does that help? I hope.
I hope so.
I hope so too. And please, I know we say this every year, and by all means, reach out to me. You'll have all my contact information and the follow-up information. So if people do have additional questions, they're more than welcome to do that.
Yeah.
Okay, I'm done.
And then, no, we've got one more question. I think this is for all of us. Preferred is tier 1.
Yeah. Yep. Preferred and standard. It's listed out in the product guide. It's listed in the provider directory as preferred or standard. So, yep.
Great. And then there's another comment, being concerned with the yearly climb of the deductibles and the out-of-pocket maximum. Will these ever plateau or come down? Even better.
I know. I have to say, when we at Harvard Pilgrim, I'm sure the other carriers can agree with this, when we started doing kind of product plan, which literally happens at, January 1st for the next year. And we started getting a feel for what this was going to look like. It literally took my breath away because let's face it, $9,100 out of pocket, $9,100. I mean, it's a lot of money. It's a lot of money for anybody. I hope, I don't know if anybody, any voice from another carrier has some insight there that I can't offer, but I agree with the concern. And it would be really nice if we could maybe move backwards a little bit.
I think I'll speak on behalf of Taro Health. I think there's a real hope that our really innovative, unique model has shown actual evidence to drive down costs, unlike other standard health insurance structures. And so I think, Helen, over time, the hope is that Taro Health will be able to offer plans that have lower deductibles, lower max out of pockets, and a differentiated experience for people. So I think there's real hope for us in doing things different, that it can really change the healthcare system.
Good. Dan, you were going to chime in?
Yeah, I was gonna chime in just to say, with the implementation of the ACA and the Affordable Care Act, I think the intent was to try to slow things down and not have deductibles and out-of-pocket maximums increase every year. And I think the reasoning why, the Bureau might be even getting involved and we're having a merging of the markets and things like that. And there really are an array of plans out there from platinum level deductibles that go as low as $750 all the way up to bronze plans that have, $9,000 deductibles. It really goes back to, I don't know if the feds will ever kind of put a cease to finally, put a ceiling on, we're only going to allow carriers to put plans out there in the market that have a ceiling of, say, $9,000 in deductible. Because it does seem like every year the actuarial values that go into developing these gold medal plans, these silver medal plans, platinum, bronze, that was all developed through the ACA implementation. So I don't know if the government will ever step in and say, yes, this is it. We're not going to allow plans to be developed beyond a deductible level of X. But I just, being in this industry for 32 years now, I remember the old days in the individual market, someone that really wanted just a kind of a catastrophic plan. They could buy a plan with a $16,000 deductible pre-ACA. So I don't know the ultimate answer, but.
Yeah. Christy, do you have any comments you'd like to add, or anyone from Community Health Options?
Yeah, this is Nancy Connolly from Community Health Options, and I work in product development. I would say that, of course, we all want to see lower deductibles and out-of-pocket maxes. But one of the things that I appreciate about the Clear Choice model is that it is offering a lot of benefits without deductible. And I think that people really can access care for primary care, for behavioral health, for specialty care, for urgent care, some really important things that can keep them well and keep their families well without having to deal with the deductible and out-of-pocket max. So that's something that I personally have appreciated about the Clear Choice model.
Great, thank you. And then a couple questions for Connor. Does Taro plan to go statewide, and when? And then the follow-up question, moving into Waldo County.
Yeah, absolutely. The goal at Taro is to be a statewide plan over time. I think, as I mentioned, our core differentiator is really around this transformational, unique primary care model. And the key thing that holds us back as we expand in is just making sure we have enough providers in each county. In Cumberland County, there's a high number of direct primary care providers that lets us build an adequate network of access for people. Our hope is that us entering into Maine is going to be the catalyst for more doctors making the transition to direct primary care. And as a result, as more direct primary care physicians pop up in each county, and as we partner with doctors to transition to direct primary care in new counties, we'll be able to expand. I think, full transparency, our goal is to be a statewide plan in maybe the next 5 to 7 years or so, and incrementally adding counties to get there. So we're really excited about it, and we're in Maine to stay, and we're really excited about expanding to places like Waldo County. I had someone actually I spoke to just the other day who was in Waldo County who was bummed to hear that they couldn't get our plan. But you know what? I think our hope is over time, like, we're going to be there for everyone. So we're really excited about expanding to other parts of Maine.
Great, thank you. Thank you. I think we're good. There is a comment about, for Harvard anyway, maybe Jody making everything say the same across, right? Have it be preferred and standard, or tier 1 and tier 2. I don't know how much you can work on that, but.
Well, I can tell you, and I think, I hope we're all talking about the same thing. If you go to our provider directory, it says standard or preferred. If you use our product guide, it says standard or preferred. So, I mean, it's right in line with each other. So I'm not sure where the confusion exists, but if anybody wants to reach out to me directly and we can kind of walk through those tools together, I am more than happy to do that. The consumer sales team, my team, member services, we use the same tools all day, every day. So if there were some discrepancy there that were causing that type of confusion, we certainly would have it addressed. But it's very clearly spelled out standard or preferred. So I apologize for any confusion. but that's where I'm at. So yes, please reach out to me. I will forward on my information for anybody that should need it.
Great. Well, I am not seeing any more questions in the chat. I think we got them all. Again, I just want to thank you all the reps from all the carriers with plans on the state-based exchange. Thank you for being here, going over your plans with the assister community. It's really, really helpful.
Yeah,
Well,
absolutely.
thank you, everybody.
Yeah, thank you very much, Helen. Our pleasure to be here. And thank you all once again to all the assisters for the work you guys do. It makes a huge impact on people's lives. So you guys are rock stars.
Great. Thank you.
Thank you.
Thank you.
Thank you.